Well, thank you, Dr. Youssef, for inviting me to speak today on teaching neurodivergent students. It's a pleasure to be a part of the Career Pathways Teaching Fair. I am Dr. Vickie Tyler Carnegie. I am a clinical assistant professor in the Strong College of Business in the School of Public Service. I am the graduate program director for the Master of Public Administration program. So let's get into today's agenda. First, we're going to talk about exactly what is neurodiversity, and then we'll discuss how to recognize some very common neurodivergent conditions and explore inclusive teaching strategies for working with neurodivergent students, and how to promote an empathetic and adaptable classroom for our ODU neurodivergent students. Let's first begin with why is this important? Why is a workshop on teaching neurodivergent students important on the collegiate level?
Found out that the gifted and talented program was just special ed on the other end of the bell curve.
So when I was getting my autism diagnosis, I found out about something called twice exceptional, which is why I wanted to stitch this because I found out there is something that is like right in the middle of talented and gifted and these disabilities. For example, I have autism. I don't see it as a disability because I was always talented and gifted. However, I really was somewhere in the middle. If you're really good at, like, let's say math and science or certain classes, but you struggle with like speech and socially and, with autism, a lot of times it's not diagnosed or it's overlooked because your talents and gifts are so much greater that they shadow any difficulties that you have. So for me, I was always academically a pretty good kid and didn't struggle in school. And so then my autism was easily overlooked. So actually, the US school system really just sees talented and gifted or learning disabled, but actually, a lot of us were right in the middle.
So, in a university environment, you obviously are going to be working with exceptional students who are neurodivergent. My why and why it's important to me to discuss teaching and understanding people with neurodivergence is because of my son, Joseph. He was diagnosed at the age of 5 with ADHD, but it's from working with Joseph and learning more about ADHD that I started to recognize the symptoms of ADHD in myself. And so I was later diagnosed at the age of 53 with ADHD. And as the prior video discussed, I was one of those students. I was in talented and gifted. I was in almost any academic program that was labeled as for accelerated students that came. But I was very fortunate in that at that period in time, I didn't understand or know what was happening to me. And later, I've learned that for women, we tend to mask it a lot more. For Joseph, I'm happy that I'm present for him so that I can help him to navigate his ADHD more. So we'll talk a little bit more about some of the symptoms that come with being on the neurodivergent spectrum. So let's first just begin with terminology, understanding what is the neurodiversity paradigm, and understanding that the neurodiversity paradigm is a perspective that views neurological differences not as some type of disorder or some type of pathology that needs to be fixed or cured or that there's something wrong with this individual. It is more of a natural variation of what occurs in the human brain. The neurodiversity paradigm emphasizes that neurodivergent individuals, we have unique strengths and unique perspectives that really can contribute positively to society. So Three of the terms that you would need to be familiar with is neurodiversity, neurodivergent, and neurotypical. When we talk about neurodiversity, it is the diversity of ways in which the human brains actually think, how it learns, how we relate to other individuals, and how we interpret the world. You'll see here the neurodiversity wheel. And yes, oftentimes it's called the autism wheel because, like a color spectrum wheel, the neurodiversity wheel has a core. And the spokes represent different challenges and strengths that are faced by neurodiverse individuals. And you'll see from the neurodiversity wheel often different conditions that neurodiverse individuals have. Typically, you know about autism, but neurodiversity also encompasses developmental coordination disorders or conditions, personality disorders, developmental language disorders, bipolar disorder, anxiety and depression, as I've spoken about before, attention deficit hyperactivity disorder or ADHD, stuttering and cluttering, obsessive compulsive disorder, autism, Tourette syndrome and tics, panic disorders, and it also includes neurotypicality, which I'll discuss more in the following slide, but also conditions of dyslexia, dyscalculia, and dysgraphia as well. You've heard of dyslexia, a writing disorder. Dyscalculia refers to math, and dysgraphia refers to writing. So, what the neurodiversity spectrum wheel and the autism wheel highlights is that each person lands on different points, and that no two individuals with a neurodiverse diagnosis or identity are necessarily alike. The areas in which neurodiverse individuals differ from the typical societal norm are in the areas of executive functioning, social skills, motor skills, repetitive behaviors, language, and sensory sensitivity. So, autism is not a one line spectrum. It is a combination of different spectrums, which can often be categorized by the different conditions that I previously notated. So, within the neurodiversity paradigm, we speak of neurodivergent individuals, and that is simply people whose neurological development or function is different than what is typically observed in the general population. And neurotypical refers to people whose functioning aligns with or is considered standard with the general population. So when you think of neurotypical, think of a person whose ways of processing information, learning, how they interact socially, and perceive information, it generally matches societal expectations or norms. By the numbers, neurodivergence is more prevalent than most people think. 90% of disabilities are invisible. It's estimated on, and I believe on the low side, that 5% of the population have ADHD, that 10% of the population is dyslexic, and that 5% of the population have an acquired brain injury, which has led to the individual being neurodivergent. So about 15 to 20% of the US population is neurodivergent. Now, you would not have known that I was neurodivergent unless it's something that I've shared. And a lot of people don't. They don't share it because of different challenges that come with being perceived as a neurodivergent individual. So let's discuss some of the common neurodivergent conditions and some ways of being able to recognize them. The first is autism spectrum disorder, or ASD. Now, with ASD, you might see delayed or even no speech development. The individual might have a difficulty with back and forth conversation, may not use a lot of hand gestures or facial expressions, but they might have repeated behaviors, repeated vocalizations, or repeated patterns. They do have a preference for things being the same. They lack awareness as to social cues and making eye contact, and often forming peer relationships and sharing their interests can be difficult for individuals with ASD. Individuals with ADHD have some of these same characteristics, especially difficulty forming peer relationships and sharing interests and repetitive behaviors. Oftentimes, if there is something that occurs, they'll become actually fixated on an area. My son was fixated on Beyblades for a while, and then it switches to something else where there's this intense focus. There are others who have ADHD that have difficulty focusing, losing track of tasks, being very forgetful. That's where I typically run. Easily distracted, difficulty in conversation, holding on to thoughts. So you want to interrupt others a lot. So having difficulty waiting turns or acting without thinking. That's where the impulsivity comes. People with ADHD often have trouble managing time. My son, he struggles with understanding days of the week, and understanding the difference between a minute and an hour. So oftentimes when speaking to him, I would have to say, and he wants to know how long something is. He's a huge movie buff, so I'll break down time for him in terms of movie segments, or this is as long as a television episode, because minutes, seconds, hours, even weeks or months, they don't compute for him. Difficulty prioritizing tasks and even completing assignments can be difficult for individuals, students who have ADHD. Dyslexia and other learning differences, they might have trouble decoding words, or poor handwriting, difficulty organizing their written work, which sometimes will result in them taking longer to complete tasks and actually requiring more effort to learn the new information. It's not necessarily that they can't learn the information. It just takes a little bit longer or more time in order to do so. And I mentioned before that in addition to the areas of like dyslexia, you might have dyscalculia, not having a good understanding of numbers, or of understanding how to write the numbers, um, seeing like the number 3 backwards or the number 5 backwards. Those are some common things that you might see. And then there are sensory processing differences where the individual actually experiences discomfort or pain from certain sounds or textures and even smells. Um, if things become loud or even busy, they're overwhelmed, which leads to a sense of withdrawal or distress. And they actually have trouble being able to ignore something that is sensory that might be irrelevant to neurotypical individuals, but it's highly stimulating and overwhelming for them, which can affect their focus and their behavior. So challenges that are faced by students with these conditions often relate to communication difficulties, inabilities to interact and to be able to have their messages or their thoughts communicated to their peers, their colleagues, to their professors or their instructors, having a sensory overload to the point where they're not able to understand or hear what you're saying when you're giving a lecture or giving instructions, because there might have been a sound that, a faint sound that has caused them to concentrate on that sound rather than what you're speaking about. Executive functioning challenges, the inability to stay organized, the inability to keep things within a structured framework. And then often, because of the communication difficulties, because of the challenges, anxiety, having a high degree of social anxiety, because a lot of times they've been isolated from their peers, being framed as different. So, anxiety, depression, and a host of mental health issues as well. So, knowing some of the characteristics, understanding the challenges that students face because of these characteristics, it's really important that we know how to support our neurodivergent students. And I think the best way to think about how to support neurodivergent students is understanding that it's action, and that it's action in 3 particular areas: action in terms of policies, in terms of practices, and the environment or the climate that you create in the classroom. And to take action in these 3 areas, it requires fundamentally communication, intention, and the ability to take practical measures. So let's first begin with discussing policies. When we talk about policies, really understand that the basis of policy surrounding how to work with neurodivergent students really comes within the law itself. There are several laws that cover individuals with neurodivergence. The American with Disabilities Act, Section 504 of the Rehabilitation Act of 1973, the Individuals with Disabilities Education Act, and the Higher Education Act, which is specific to secondary education. These laws require that institutions are non-discriminatory, that they provide equal access, and that they provide reasonable accommodations for individuals with disabilities, neurodivergent individuals. So this requires the implementation of intentional practices. One of the first is the Universal Design for Learning, or UDL. Now, this is a framework that designs courses to be accessible to all students, including those who are neurodivergent. So, in this framework, what it entails is that when you're designing your courses, when you're working through the different assignments you'll have in your course, when you are detailing your syllabi, that you think about multiple means of engagement, multiple means of representation, and multiple means of action and expression for your students. To break this down further, when we talk about multiple means of engagement, it means that you want to vary your participation methods. You want to avoid relying on only having your students raise their hand in the classroom or volunteering to answer a question. You want to use methods like think, pair, share. This is a method where you can ask the students, give the students a question, give them time to think about it. They can think about it by writing it down. This gives the student the ability and the time to process the information. So after they've had to think, time to think about it, you would pair them with another individual in the class and then have them both share the information with each other. This allows for connection, it allows for community, it involves better communication. And so once they've had time to share individually in these small groups, then you can also open it up to the larger group saying, is there anything that you learned in your small group conversation that you think the whole class might be interested in? Again, this broadens the conversation. It helps people to recognize that their ideas are important and worth sharing. So that's one method of engagement. Having small group discussions. When you are having discussions, instead of them being broad questions to the entire class, you can have one discussion question, break individuals up in groups of 3 to 4 students, have them discuss it within the group, and then have the group share out. And so, a lot of times, what you want to think about is where you can have these written questions, where you can give space and time for thinking so you can have broader participation. So, that's engagement. Another one is representation. You want to have multiple means of representation. Giving directions verbally is one way, but also have the directions in writing. Try to break down assignments, larger assignments, or things that might be complex tasks into smaller, more manageable chunks. And then, in order to make sure that the information that you are providing that is accessible, you want to offer the content in different formats, such as a visual slideshow, an audio recording. You can do podcasts, or even providing the student with text outlines. Again, this is to work with individuals and their different processing styles. Some do well with writing. I recognized very early on that Joseph was more of a verbal learner. He could understand it if you spoke it to him, but his writing was not on par with his ability to understand verbally. And so this is one of the accommodations that he was able to receive. Also providing things like multiple means of action and expression. So offer different ways for students to demonstrate their knowledge. It could be, like I said, if you have a student who doesn't do well in terms of writing, but orally they're gifted, they can do an oral presentation of the work. You might instill like a project for an assignment or have them do videos instead of a written exam. So that would look like in your syllabus that you actually offer the options of different ways to complete the assignment. Allow students, if you're in a physical classroom, to move. Allow them to use the fidget tools, to take short breaks. One of the things that I do in the classroom is I say at the beginning, you know, you're adults. Take care of your needs. So you don't have to raise your hand to leave my classroom. If you know that you need to leave, you know, go ahead, just come back quickly. You want to encourage that freedom of action and that freedom of expression. So I've already talked about breaking down projects into smaller parts. But the interesting part about that is if you're breaking it down into smaller parts, you can also have individual deadlines with those smaller parts to help the individuals with planning, which goes to that where individuals have problems with executive function and organizing information and materials. So some other inclusive teaching strategies is to have very clear, structured instructions. So another way to think about it is how can you scaffold your assignments? How can you break it down where you're leading from one section into another? You want to make use of visual aids and written materials. One thing that is important is trying to have the visual aids and the written materials, things like this PowerPoint, to have them available prior to the class session for the individuals who are identified or self-identified as needing this as an accommodation. You want to keep your slides simple. You want to keep them to 3 to 4 bullet points with lots of white space. Keep your font large, 20 point or higher. You want to avoid your slides being text heavy. One reason why is you don't want that comment, oh, they just read from the slide to us, right? You don't want to hear that. But also, it avoids your students who fixate on the written from reading along with you and missing other important information. You still want your students to have their attention on you and your presentation rather than on the slide itself. The slides are augmentation, right? You want to use PDFs when able. PDFs have a higher degree of accessibility and readability. So when able, instead of just having Word documents, if you can make it a PDF, it's a nice thing to be able to do. And then try to have consistent routines. So if you're working even in the classroom or online, begin the class with a routine manner, like having an agenda, have your classroom set up. If you have, let them know, this, what I typically do is I'll have some type of brain work. I'll go over what the agenda for the class is. I might have a video discussion, and then I'll go into lecture. So if someone were late for my class, they would know based on where they entered, where they are in the class session. Again, just based on this is the way that I typically conduct. This is important for those neurodivergent individuals where routine and familiarity is important. Working with students, being flexible in deadlines as well as in how they participate is important. We're talking about accommodations. We're not saying that people with neurodivergent, who are neurodivergent, that they shouldn't have deadlines or that they shouldn't be mandated to participate. It's that they be given different options. So I currently, I might have a student who is speaking impaired and doesn't feel comfortable doing a group presentation. So flexibility, are you willing to have it recorded? Are you willing to speak to me one-on-one doing it? It's not that they don't have to do what you've required or what your assignment is. They still have to meet your objectives and to display competency, but it's working with people. And you can see from the pictures to the side that there are different ways, different assistive technology that can be used by individuals with disabilities. And one of the major ways is through asking, asking the student what it is that they think that they would need, what is it that they think would help them to be able to be successful in the classroom. You also want to check for understanding. This is a good thing at any time during a lecture, right? That's one of my ways of checking in. I'll go, right? And if somebody goes, if I see a blank stare, I'm like, okay, not right. Or even I'll say, are you tracking? Is everybody with me? Checking in, giving people the space to ask the question. Because sometimes, even though we think we've been clear, not necessarily clear, right? So give people to check in, time to check in from their perspective. And then finally, be patient and open to questions. I really did love this quotation from Joyce Meyer, where she says, patience is not the ability to wait, but how you act while you're waiting. I mean, you can be patient and rolling your eyes and sucking your teeth like, or, grimacing like, I really need to get it over with. Or you can really show an attitude of, okay, I'm here. I'm here for as long as you need me to be here to help you to understand this. And that, just practicing that bit of humanity helps. So, just in terms of practices, you want to use clear, precise language. You want to make sure that your work is accessible, that you have structured headings. Use color and contrast where you can. As you can see from my PowerPoint, use images, hyperlinks. Try to use plain language. Use tables and charts to simplify dense information. You want to use supplemental resources. I'll give you a couple in the upcoming slides of resources that the university has to be able to assist you. But most of all, talk about it. Be open to communication. Be open to the understanding that There are different abilities, and with those different abilities comes different gifts. Okay, and environment. Finally, environment. You want to promote an empathetic and adaptable classroom. You want to foster a culture of acceptance where you respect individual differences. And one of the notes, I bolded this so I can remember to talk to you about images. This is a slide about being empathetic and adaptable in the classroom, but it also talks about respecting individual differences. There's not a person on the slide, but I think that this picture fully encapsulates respecting differences and individual differences. And and I also think that it can show peer support and collaboration. So sometimes using images that aren't exactly tied to what you are speaking about, but will still drive home the message in a different way. Those are the types of things that you can think about and look for when you're designing your slide work. So also when you're thinking about environment, accessibility, you want to check the room. So one of the things you might have an individual that needs more space around them, like they might need quiet spaces. So, you know, when before you have your your first class, they might need physical space. They might have you know, a wheelchair, walker, crutches. So that is for, you know, persons with physical disabilities, but and you would know to check for those. So also think about individuals with those invisible disabilities. um, think about note taking and support. Is there another individual who is willing to help to take notes for the individual? Allow for things like noise canceling headphones. The individual might need some type of difference in terms of lighting. And if so, these are things that are addressed prior to the um, the first classroom session, because you will get an accommodations letter. Extended time on assessments, for tests, for quizzes, and also the ability for the student to use technology such as speech to text. Think about and promote things that would support the individual's mental health and well-being. Promote them advocating for themselves, for their needs. A lot of times, individuals who are neurodivergent, they mask a lot, or they might not want it to be perceived that their accommodations are asking for special privileges, but help them to understand that self-advocacy is not asking for a special privilege. It's providing their accommodation, which is required by the law. Look for and recognize signs of distress. If you see that the individual appears like they're becoming frustrated or isolated, you know, reach out to them. So know about campus resources and support services. ODU has a lot of them. We have an Office of Educational Accessibility. We have ODU Student Support and Advocacy, as well as ODU counseling. So there are resources available to our students. So if you see a student who's struggling, you know, and they might not already have accommodations, maybe not even understand that they are neurodivergent. It's not that you have to, you know, say that, okay, I've diagnosed that you are neurodivergent, but you can say there are supports available. and help them, help them to the resources that can assist them in being a successful student. So the key takeaways, hopefully, that you walk away from this presentation with is that neurodivergence is about diverse thinking, different ways of perceiving the world. But it's totally normal. Different people have different ways, different lenses of looking at the world. That there are inclusive strategies available, but those inclusive strategies, when they are put into practice, they actually benefit all students, and that continuous learning and empathy are essential. Just remembering a person's humanity goes a long way in working with students, not only neurodivergent students. Well, finally, I just want to thank you for your time, and I wish you much success in your teaching careers.